So, welcome to our meeting. This video production is a planetary education project of Life Celebrating Health. And what we're doing is more than fun. I would warn you, that there's FBI interrogation on everyone who ever makes a copy of anything. So you would think that this disc is one of those because it'll be a DVD for you to hand out, but ignore all that FBI stuff because you're free to share copies of your DVDs when we get them for you to anyone who has a need to know. And of course, that means that folks who are suffering will thank you forever for sharing that.
I sat here, and you're going to hear my story briefly in a few minutes, but I'm here for a more important reason. Dr. Faber asked me to, and I do have the privilege of presenting Dr. Trowbridge with a citation of appreciation. And there was 3 or 4 of us patients, I think, that actually had something to say on here, but I've been in the clinic for probably close to 11, 12 years now, and I can say probably hundreds of patients that I've talked to would have been very, very happy to sign and acknowledge Dr. Trowbridge with this certificate. Is Susan Rogers here? Susan? She's one that, of the signees, and I'll just let you come on up and tell you a brief story, and if you want to read your brief note, that's fine. If you don't right now. Sure.
Can everyone hear me? Okay, I'm Suzanne Rogers, and I'm from the Woodlands, Texas, and I've been coming to Dr. Trowbridge for about 4 years. Just a brief summary here of what I've written in honor of Dr. Trowbridge. I suffered a chronic infective septicemia causing severe fatigue, pain, and lack of sleep. I required an IV of antibiotics as well as high-dose clindamycin, which I still take the oral dose, but I'm avoiding a lot of my IVs because of the customized treatment that I'm receiving. I did natural immune boosting treatments as well as customized medical treatments as directed by Dr. Trowbridge when the previous treatments failed to provide improvements. Dr. Trowbridge saved my life from one of daily pain, suffering, and disability. Thank you. Do you want me to go on to the rest of it? I would like to cover some of the other things that have been really important to me, because in 1983, I was injured while flying on a major airline. I had 2 back-to-back injuries, and the interesting part of this is when you have an injury, anyone that's had an injury, you know that everyone in the world wants to take out a part of your body. So 50-plus doctors all wanted to operate on 3 discs. My hands, they wanted to take out 2 ribs. For some reason, I resisted all of them over the course of a 5-year period. And during this time, I realized I was really sick, and I knew I had a massive infection, but nobody would listen to me. All they said was I didn't want to go to work. So in walks my first shrink, and he gave up on me within 5 minutes. He said, "You're fine. You don't need me." Anyway, so my good friend of mine knew a doctor in New Orleans that studied bacteria. I went to him, and within 45 minutes, I had an answer. He used a test that pathologists do not use in this country anymore. Anyway, that doctor treated me every 3 months until he retired in '01, and then he passed away in a couple of years. His wife found a doctor in Georgia, so for the next year, I went to Georgia. That doctor, fortunately for me, said, "You know what, you would really benefit from chelation therapy," and I happen to know a great doctor in Houston. So all these years now, think about it, I traveled every 3 months to go and be treated, and I could have been here. The crazy thing is I knew about this doctor because he did FA, he worked for the FA and did a lot of the, what am I trying to say? Pallant Medicals. Anyway, I was so mad at myself. I thought he's been at my back door, 40 minutes away. But when you have to understand, when you're doing all the stuff I had to do for all those years, the last thing you need is another doctor. So I kind of ruled him out, and he, just was kind of, I guess, in my hip pocket. Anyway, the doctor in Georgia encouraged me to give a call, and I did. And I want to make a comment about my husband because he's 10 years older, and so when I made the decision that I would go to Dr. Trowbridge, I told him I made the appointment, but we were both going, and he said, no, I don't need to go. And I said, well, you're 10 years older. I'm not going to prolong my life without prolonging yours. So the other interesting part of his story is he, I think he decided on his own, I don't know, Dr. Trowbridge may have told him, but he decided to go have a heart scan. He was told that he would have a major heart attack in 5 to 7 years. So we both made a big commitment to chelate every week for that year. And at the end of the year, he went back and had a second heart scan. And our other doctor that satisfies the side of the PCP for your insurance companies looked at us and said, there's no way. I mean, that's not what happened. He said, well, then they just diagnosed it all wrong and read it all wrong the first time because that wouldn't do that. So anyway, back to my story, though, I now am able, whatever he has told me to do, I do, and I am able to go 9 months. And when I do get a little sick, it's nothing like what I used to, because when I got sick prior to Dr. Trowbridge, I literally thought I would die, and I would think I will never make it to go out of state for the next treatment. But anyway, this man, I believe, is probably going to get me where maybe I don't even have to go and have these treatments if I'll just continue to listen to him. So anyway, he's a great person, and I know all of you would agree with me.
I'll make a short statement first. God is the creator and preserver of all mankind. Dr. Trowbridge's work has enabled me to enjoy superb health after suffering both back and heart problems. Dr. Trowbridge is God's blessed minister of medicine. I really believe that, ladies and gentlemen, from the bottom of my heart. 12 years ago, I almost died of a major heart attack and went to 9 different cardiologists, almost died about 4 times. And just by an act of God, Mr. Apple at the Thrifty Pharmacy led me over to Dr. Trowbridge. He said that there was a man in town called the Rumble and Umble that had the alternative medicine process that could heal somebody. I had no idea that there was an alternative. And I was led over to Dr. Trowbridge. I think it was primarily just an act of God. And from the alternative chelation therapy done on my heart, 7 or 8 years, well, let's see, 2 years ago, I suffered, I was enclosing a petition in my new flower shop that I had just reopened, and ruptured several discs in my lower back. And well, it was surgery time again. And 19 years ago, when I was a carpet layer, lifting heavy rolls of carpet for 13 years and crawling around the floor and getting up and down, working on your knees all day long, I did some serious damage to my body, big time. And I had to get out of the floor business. And I was forced into the flower business. So what does carpet and flowers have in common? It's called making a living. So here I am in the flower business again, and here I'm putting a door up and on a petition, and I ruptured my disc. Well, I had surgery 18 years ago, which I never got over. I said, man, I don't want to do this again. And I've been hearing about reconstructive therapy. Dr. Trowbridge gave me 30 of those treatments. It took 30 treatments of reconstructive therapy to get me back up on track. I'm going to tell you right now, I've been on both sides of the fence, and believe me, this side of the fence I'm on now is a lot better. I promise you. That grass over on that other side, where they take a knife and stick it in your back, folks, that is not fun, and it don't work. It didn't work for me then, and I can tell you right now, I'm back. I was up and walking around and doing the things I wanted to do without surgery. And I'm virtually painless, and there again, I'm still not over that surgery I had 18 years ago. I still have a problem with my left leg. I'm now walking with a limp because they took some stuff out, and he can't fix what ain't there. What can I say? Dr. Trowbridge, you are truly God's minister of medicine.
I take great pleasure to welcome you to this featured presentation of our seminar today. And I'd like to introduce to you one of my mentors. Now, don't ever think that he's a nice guy when he teaches. He's dogmatic about what he has found to be the truth. He's born in Des Moines, Iowa, a state famous for sifting out the candidates likely to win our presidential elections. And I think he actually agrees with the idea of vote early, vote often. Now, Dr. Faber earned his Bachelor of Arts in Biology and Chemistry in 1972 and was named a Drake University Scholar. I can testify that in a lot of ways he really is a bulldog. He earned his medical degree at the University of Health Sciences College of Osteopathic Medicine in 1976, the same year that I earned mine. He trained at the Pontiac Osteopathic Hospital in Michigan. That brand is gone now, isn't it? No more Pontiac. But they were building excitement, and certainly did when he was there. He began his solo practice in 1979, and Dr. Faber experienced the frustration in pain management of not being able to help most everyone. Since then, he's been a pioneer in developing new technologies, and his bright ideas and developments in treating human suffering have been many and fundamental. He's held numerous trusted officer and director positions in professional organizations. He is truly a leader in integrative medicine. He's certified as a specialist in reconstructive therapy of joints and treatment of sports injuries and arthritis. And most definitely, he is a teacher. There are dozens of professional and public lectures and interviews and articles that he has provided over the last 30 years. And he is most assuredly an author. Neural therapy techniques originating in Germany almost 100 years ago are documented in his book, Instant Pain Relief. And then the ever-popular book that we wrote together about our experiences in helping patients with joint problems, Do What You Want to Do. Now, I'm privileged that he invited me to write Chapter 18 in his updated edition, and we labored long and hard over that chapter because it talks about hypermobility or ligament laxity syndrome and chronic fatigue and fibromyalgia. So, with that brief introduction, I take great pleasure in introducing to you my doctor, William J. Faber, Doctor of Osteopathy.
Thank you, Dr. John. So I've been giving this lecture since the early 80s, and that's what I looked like at that time. And any author or presenter is always interested in audience feedback. And so after I gave them the cause of the #1 disability of Americans and people worldwide, and gave them the answer to how it's absolutely fixed, the feedback I would get was, get a new picture. Okay? So I finally succumbed, and that's the newest picture I could find. That is the Billy Joe there. So what is life? Well, it's an experience, it's a journey. And in life, there are motivators, and the researchers tell us that people are motivated primarily by two things, is to avoid pain or avoid a loss, or to obtain a gain. So in life, we want to create the ideal scene. So the ideal scene is where you can have it all, where you can eliminate pain and you can return to function. And what I'm going to show you today is that you can have both with reconstructive therapy. You can eliminate pain and actually restore structure and function and be preventative from further injuries. So you can truly have it all. So here's Faber's Facts of Life. If you do not die, write this one down, you will get older. Okay? You need an Iowa boy to tell you that, right? Somebody from out of town. And in life, we're subject to the ubiquitous force of gravity. It affects us in two ways. We have falls, and it affects us when we stand, when we sit, when we're born, when we sleep. We cannot escape the forces of gravity unless we're in Houston and go on the space shuttle, etc. But it's a big, big factor that doctors don't mention or consider, but you'll find that reconstructive therapy is anti-gravity. You don't walk in, you don't spacewalk, but it holds you up. The number one cause of this of gravity is that it gives people pain and disability. And this pain and disability is the number one cause of or cost in the retirement age. This is not from Bill Faber. This is from Fidelity Investments. Have done studies on this. And the number one cause in cost in retirement is not medical care. It is not pharmaceutical drugs, although they certainly are very expensive. It's not surgical care. It's not hospitals. It's not nurses. But it is domestic care. Getting dressed, getting out of bed, getting fed, getting washed is the number one cost. Unaccounted and by people in retirement. But it's absolutely the number one cost. Well, the reconstructive therapy is known that it gives those abilities back if you lose them, of getting out of bed, walking, standing, sitting, feeding yourself. So in this talk, we have to go over some false beliefs. And those, of course, are foisted upon you from the universities and the doctors that go there. And the first false belief we're going to take care of in the course of the presentation is that cortisone is good for joints and tendons and ligaments. Second false belief is that the Vioxx, the Celebrex, the ibuprofen, the arthritis medicines that you see on TV and are pro-offered by the doctors as being told that they're good for arthritis is another false belief. Exercise will help arthritis. We'll explain why that's a false belief. I'd like to say that, have a note of clarity, that Dr. Trowbridge and myself are not doctors. We are rehabilitating doctors. And so that's why we promote this thing. Age. The doctors will tell you that since you've had the problem so long, or it's so severe, it can't be helped, or the only thing is surgery. And that losing weight will help, will fix your back, your ankle, your knee, your hip. Not true. Also, surgery is the only thing that will help the problem. Bill elucidated his personal experience that many people are worse with surgery. Unfortunately, your own granddaughter, etc., is worse with the latest. I, too, was faced with having a fusion surgery. And that also the false belief is that you can't regrow cartilage, ligaments, tendons, connective tissue. So now we're going to explain why these beliefs are false, starting first with the case history. This gentleman was 84 years old when he came to the clinic, and he had bone-on-bone knee arthritis. His mode of transportation was walker, and some days he was so weak he had to use a wheelchair. He was deemed to be too old to have the surgical joint replacements. He came in because his daughter in Milwaukee heard me on a radio program and told the mother, Marguerite, about this technology. He was breaking her back, okay? Because in order to get out of the chair, he had to hoist him up. And so it was, when you get to that phase, it was just like I was talking in the beginning about the #1 cause of disability, is you can't take care of yourself to get up, get back in bed, and do your things. So it was looking like nursing home for the rest of his life. So he came toddling in, some 250 miles from the clinic, and each visit we did a little ritual. He would be sitting at the side chair, and I would take the one arm, Marguerite would take the other arm. On the count of 3, we would help hoist him up. He would go the 2 steps to the exam table. Then we do the technology, which we're going to explain to you. This started in the fall. He'd come about every couple weeks. And we did this ritual every time. 1, 2, 3, hoist him up, walk to the table. So one morning in the spring, I came in the exam room. He was on the exam table. Before I could say a word, he said, "Hey, Doc, look at this." He slid off, walked all the way around the table, unassisted, and he went on to a full recovery. And there he is in that spring, mowing his jungle. You can see he's somewhat overweight, and he lived another 11 years independent, not in a nursing home, and he completed his therapy with bone-on-bone knee arthritis. So we have the oranges and the apples. The orange, the traditional medical and surgical method of treatment. When you have a method of treatment, you need goals for that treatment. Their goals are as follows: to block pain is their first step a lot of times. So then you give the aspirin, the codeine, the OxyContin, the MS-Contin, the fentanyl, the Opana, the Demerol, the Talocin, etc. In some cases, they get fancier and put the narcotic, infuse it into a pump into the spinal cord. This doesn't fix anything, but it may alleviate it for a time. Then in the 70s, when Dr. Trowbridge and I were in school, out came the first one. When we were sophomores, came the ibuprofen, and this was hailed as a miracle drug. This would revolutionize arthritis treatment, we were told. And then came the follow-ups to that, the Nalfon, the Clinarol, etc., and now to the, a number have been removed. Now, when they remove a drug from the market, it's not because of side effects, it's because of death. Considered a severe side effect. And a number of them have been removed. Baclofen has been removed, and Vioxx has been removed from the market. And butazolidine, which I took with my back problems, has been removed, and others have been removed from death side effects. When there's less side effects than death, what they do is the government requires them to send a different type of a warning. And it'll be, in the PDR, it'll be a black box warning, which means the severest of side effects, although they don't explain that when you look at the PDR. But they'll give it, they'll add it to the adverse effects. They might require the company to send all the doctors in the United States a telegram informing them of the side effects, etc. But really, they're not really removed unless death. Now, every year, about 12 new drugs are introduced, new to the market, about 6 come off because of death every year. So let's move on in the schema of the orange system. The next step in the 60s, the early 70s came the arthroscopy surgery. This was hailed as another revolution in medicine in that they would remove torn and frayed and roughened parts, usually from your knee, sometimes the shoulder, and sometimes other joints. Well, this is akin to you've got a leak in your roof, and you call the roof guy, and he says, well, what you have is some splintered rafters, because your structure is your joints, your tendons, your ligaments is what holds you up. And he says, what you have, comparing your body to a roof, is that you have some splintered rafters, some porting. So I took my Milwaukee Sawzall, and we trimmed them down. Thank you. Thank you very much. Did you get any new lumber from the lumber yard? Oh, no, we didn't do that. Well, you want that guy out of your house because he made your roof weaker. Well, that's what's being done with the arthroscopy surgery, and we'll talk more about that. Then also, we got to live through all of this. When we were in school, the artificial joints were first come into use. Before that, people got pinnings, and where they just put nails in your hips. But now they do the artificial joints. Well, Dr. Trowbridge points out that they're not really properly called joint replacements. That's a euphemism. It's better described as a joint amputation followed by artificial insertion. Many people that have a joint replacement say they have a new joint. Well, their old joint is thrown away, cut out and thrown away, and then they have an artificial one. And isn't this great? You know, we really like that. So the model of the great success story from the orange system, the university, is the patient has all these different procedures, and they end up pooping out their right armpit and peeing out their left armpit. Isn't that great? So we're going to discuss mainly, but we're going to contrast at time because it adds confusion about what people think. And so, but we're mainly going to talk about the biological method of joint treatment, which we only have two goals, is to aid the body's healing. So this comes with improving the diet, getting rid of the soda pops, getting rid of the alcohol would be a good one, or at least limiting it, improving the quality of the foods that are coming in, and supplementing with the vitamins, the minerals, the enzymes that the body needs. And if that shouldn't work, well, here is massage, helping the body heals itself, some physical therapy methods, gentle chiropractic, gentle osteopathic, help the body, gentle exercise. If that doesn't work, we stimulate controlled inflammation, which is the body's healing mechanism to cause a natural, permanent reconstruction of structure. And so that is what we'll talk about for the rest of the presentation. So here we have the knee joint. Now, I'm going to state that we only have a few joints presented, but this applies to all the joints in the body, okay? But we only have a few representative presented. So we have the weight-bearing joint, the knee joint, and in the brown here we have illustrated the cartilage or meniscus. The cartilage or meniscus has two functions. It has a spacing function to keep the joint apart, and it has a shock-absorbing function. The ligaments here in gray have three functions. They connect bones to bones, they limit the range of motion between the bones, and they are the primary stabilizers of joints. Now, tendons are not illustrated, but we're going to talk about them. They are a layer out from the ligaments. They're attached one layer out from the ligaments, and they're attached on one end to the bone. The other end is attached to muscle. So their primary function is the movement of bones. They have a much lesser value in supporting of joints. And we'll go over that factor as we go on. But the primary support, the primary thing that's holding your neck up, your back up, your body up when you stand are your ligaments and your connective tissue. Connective tissue is all about encasing this. It also has a supporting function. Now, when one gets injured, let's say we have a force vector coming from that side. The joint motion, as you know, is limited by the ligaments. But if there's still sufficient force, the ligament, the tendon, the connective tissue will tend to tear at the attachment to the bone. It's like if I tear my pants or my shirt, it's going to tear at the seam. Well, the seams of your body are where your tendons, your ligaments, your connective tissue attached to the bones. Okay? So there are degrees of this sprains and strains. A strain has a T in it, and so that refers to tendons that are torn or stretched from the bone. A sprain has no T in it, and so it refers to ligaments that are torn or stretched from the bone. There are first degree sprains or strains where the ligament and or tendon is torn a little bit from the bone. A second degree, the ligament or tendon is torn more from the bone, and a third degree, torn completely from the bone. What we're going to do is tell you and show you how all these are completely repaired with the technology of reconstructive therapy. And how they're repaired is we take a syringe and a needle, much smaller than that one, and inject local anesthetic and a natural irritant of various types into the precise area where the ligament, the tendon, the connective tissue, the cartilage is torn or is completely gone. And that causes your body to actually regrow that tissue and permanently repair when enough therapy has been done so that you can get elimination of pain and return of function. So you can get both avoid pain and gain at the same time. So now, why is it that the spurring, or why is it that arthritis forms? The spurring of arthritis. Well, it's from one of the few laws in medicine called Wolff's Law. He was an orthopedic researcher in the late 1800s. And he said, Wolff's Law basically said, bones respond to stress by making more bone. Now, when I say stress, I do not mean the stress such as the Congress and the IRS and the FDA and the psychologists refer to stress. I mean stress such as the engineer, the physicist, and the architect refer to stress, frictional stress. So bones respond to frictional stress by making more bone. And here we see this. We see a knee joint where the cartilage is completely lost, and the underlying ligament is torn in this case. The underlying ligament being torn causes the cartilage to wear down, producing more friction, and the friction in time must make the spurs as the body's last-ditch attempt at stabilizing the joint. The body's trying to help, but it does it at a cost. One is that when this occurs, there's often an unpleasant popping, grinding sound. There's often a loss of range of motion should it occur in the shoulder because you hit those spurs. And there's frequently a lack of endurance and pain when that occurs. So now you know more than most physicians do, actually, about arthritis. They can recognize it, but they don't know the cause, which I've explained to you clearly. Why they don't know it is because we have a very elaborate and veiled program to get us all to be pimps for the pharmaceutical and the hospital industrial complex, basically. So there's the question that somebody wanted to ask. Why are they not doing that? Is because it's controlled by the pharmaceutical industry to get us all to do that. So 35% of people have arthritic disease in less than 10 years after the knee cartilage surgery. Why? Because the cartilage has a spacing function. So when you lose the spacing function from them nipping it out, they say, well, it was roughened and frayed and torn. And so we just nipped it out. But that they don't put anything in. It's like the government. When they take from you, they don't give you anything back except trouble. That produces friction when you lose that anatomy from them nipping it out. And this is from James Fox, the orthopedist of the Southern California Orthopedic Institute, that you'll get arthritic disease when you have your cartilage operated on. So here we have another example of arthritic disease where the ligaments are intact, but the cartilage has been worn away from either inadequate nutrition, inadequate hydration, maybe repeated wear and tear, gravity issues, maybe even genetic issues. From whatever reason, if that cartilage gets thinned, the ligaments must be more lax, and in time you must get the arthritic process from Wolff's Law. A law in nature is not like something Congress makes, which just is a fictitious bunch of crap foisted upon you. A law in natural science is something that occurs all the time. It's not an issue, a debate. It's not a theory. So here we have it in the spine. In the beige here, we have the vertebra represented. In the red, we have the spacing disc and shock-absorbing disc. And in the yellow, we have represented the stabilizing and interconnecting ligaments. When the discs become disrupted, degenerated, lose their height from any reason, the ligaments must become more lax, and therefore you have the friction and you have the arthritic process in motion. And so the patient comes in like this with the ligaments lax and the disc degenerated or lost height, disrupted. And what we do is regrow that with the stabilizing ligaments. And when that friction is off, the disc can get its nutrition, it can get its hydration, you turn off the excessive inflammation cycle from the friction, and that disc can heal. So why is it that arthritic problems are so long-lasting? Everyone knows that you can have a big belly surgery, you can have big chest surgery, heart surgery, and these people can do well. And they can do well potentially at length and not have recurrence as a problem. But somebody sprains their ankle in high school, they can have problems their entire life. They don't do well with orthopedic neurosurgery. Well, why that is because of the rule of the artery is supreme. This is a cardinal principle of osteopathic medicine, which basically states where there is good blood flow, there's good healing. There's good carrying of nutrients to that tissue. There's good carrying away of waste products, and there is good immunity from that blood flow. So what's the converse of that? Well, a stroke or a heart attack would be the converse of that. A stroke would represent either a bleed or lessened blood flow to the brain, and so you have dysfunction, pain, possible infection, disease. Also a heart attack, very similar. You don't have good blood flow to the heart, either a clot or a bleed causes the tissue to actually die, painful, etc. Well, the fact is, ligaments, tendons, cartilage, disc, connective tissue have poor blood supply. Therefore, poor healing. So it's blood that produces the healing response. If you cut your finger, the inflammation started from cutting your finger. The contents of the cell wall and the contents of the cell will present itself to the richly blood-supplied skin. And everyone knows that unless you got severe diabetes or a severe infection, that as long as you don't throw dirt in it, as long as you don't keep pulling it apart, that'll heal without the doctor or the nurse practitioner sewing it together. And so this is the reason why joint problems are long-lasting, because of their poor blood supply. So it's inflammation is the body's healing response for all tissues in the body. It's a fact. In fact, Chapter 3 of Stanley Robbins, the book Dr. Trowbridge and I used for the study of disease pathology, and all medical students in America and other English-speaking countries have used for 40 years. Chapter 3 is entitled Inflammation and Repair. The opening remarks of this basic medical text state that the inflammatory response sets into motion a complex series of events which heal and reconstitute the damaged tissue. Now, in this process of inflammation, there's more, the blood, there's factors that are released. These inflammatory factors signal more blood to travel to that injured area. And in the blood, there are macrophages, a type of white blood cell, and platelets, a type of cell, that will travel to the injured area, and they do a cleanup function, a walling up function, a repair function, and then they release many growth factors. And here are the names of some of them, which are the scientific names, but I'm not, this will just be there for the disc when you get it. But I'm going to explain it another way. There's mitotic growth factors released from the blood, the macrophages, in response to an injury and inflammation, which cause new cell division. So you have stem cells divide, and you get new cells in the damaged area. There's angioneogenic growth factor and endothelial growth factor. These are growth factors which cause blood vessels, so more pipelines, into the damaged area. There is a stem cell called a fibroblast, which is stimulated by fibroblast growth factor, which was released by your body in response to an irritation or an inflammation, and that causes your structural tissue to be laid down, your connective tissue. So you might look at that as more mortar going into the area, so cells, more bricks, more pipelines, more mortar. Cartilage, and we'll show more on that. Cartilage is regenerated. Chondroblast growth factor is stimulated. Osteoblast, bone grows in the area. Skin can be regrown by this process. Nerve growth factor, and we'll talk a little bit on the next slide on new nerves are actually grown and repaired in the injured area, and many other actions. It's a very complex symphony of reactions that your body magnificently knows how to do if the right stimulus is given to it. Now, a little deviation from this program, but nerve growth factor is also secreted in response to romantic love. Now, this is romantic love, and research has shown a significant increase in nerve growth factor in romantic love. So the problem is it only lasts about a year, because then you got the baby, and then you got the dirty diapers, is what my theory is, and that probably lowers it. But the second love, romantic love, it actually in that growth factor increases all the nerves growth, spinal cord, brain, peripheral nerves, spinal nerves, etc. So evidence for cartilage, we now have an ultrasound report in our clinic files where we increase the patient's knee cartilage from 3 millimeters to 7 millimeters from reconstructive therapy, which is a 133% increase. And here is the after of a patient with bone on bone. Here's the before bone on bone. There's the after, showing the cartilage regrowth. Can you see that? Okay. I'm from Missouri, so this is show me. Okay? We don't believe anything? Show me. There's that guy again. There's a relatively new hybrid of this therapy, or you might say another tranche of this therapy, called platelet-rich plasma. In this therapy, they take your blood out in a test tube, and then they spin it down in a centrifuge. And in the centrifuge, they take the platelet component, which I said within reconstructive therapy, the platelets are signaled to go to the injured area. And they take the white blood cells, too, with a little bit of the plasma, and implant it, or they call it grafted. It's injected, but they call it implanted because it's your own tissue. And they put that in to your joint areas. Tiger, he had 4 knee surgeries. A lot of people know that, and he wasn't doing well, as many people don't do well with surgeries. Well, and somehow somebody told him to get PRP, and he had PRP recently, in addition to his other activities, I guess. In the 2009 Super Bowl, 2 players from the, wasn't it the Steelers that won? The one fellow had PRP that was on the bench with disability, got the PRP and became the MVP for that game after PRP. So it's you might say it's another method of reconstructive therapy. Here's evidence from the 50s. Dr. George Stewart Hackett, MD of Canton, Ohio, took rabbits with normal tendons here, and he injected the one on the left 3 times with non-irritating solution. The ones on the right he injected 3 times with irritating solution. He sacrificed the animals and biopsied the tendons, and he found that the one injected with the irritating solution became 35 to 40% larger in diameter and heavier in weight than the ones injected with non-irritating solution. Now he took x-rays of these same tendons, and here's the ones injected. I want you to pay attention to the white area. This is the ones injected with non-irritating solution, and here's irritating. So they're actually more bone attachment to the tendon and ligament. Now, the girls, that doesn't probably mean that much to you, but for the guys, that means the stove bolts, the big bolts. We like the big bolts. So you're actually attached stronger. Not only is the tendon, the ligament bigger in anatomy, stronger in anatomy, but then it's attached with the stove bolts, the bigger bolts. For us guys, we like that. Scientific data. The University of Iowa took the Hackett experiments of the 1950s and added the advances in biochemistry and electron microscopy in the 30 years that happened. And they basically repeated his experiments, injecting the rabbits with irritating solution, one group, and non-irritating. And they again found what Hackett found, that the tendons and the ligaments increased up to 40% above normal. And they published that in 2 scientific journals in the 1980s. Here's the work of Dr. Tom Dorman. This is a human histology slide, and this is from a human sacroiliac ligament. That's a major ligament that is in your low back, holding your spine up. And the patient was injected 3 times with normal solution on this side, and he was injected 3 times on his other side. You have 2 sacroiliacs, left side and right side. He was injected 3 times with irritating solution on his other side. And what he found confirmed what the Iowa studies found, is that there's actually more cells. These are nuclei. okay, of cells indicating more cells. You can see over there, you just see these little tiny little pepper things. Those are the nuclei there. And the cells they found, like the Iowa studies found that the cells were more numerous and they were plumper. And then further, they're undulated, which means they were, well, undulated, like that. But that gives the other fact that when you tear or stretch your ligaments, they're looser, and so this makes them tighter, which you want. So the body knows exactly what it wants, and this is shown. Now, there is a mark of contention that Bill brought out that about doctors, and they'll say that, oh, well, that's just scar tissue is one of the things they'll say. This is just scar tissue. This was reviewed by a pathologist, and this is no disease process whatsoever. That this is not scar tissue. This is normal replacement parts. Okay, so one thing about reconstructive therapy, if you're a Ford, you get Ford parts. With the traditional medicine, they'll put in Toyota parts in your Ford and tell you how great that is. So another study conducted by Dr. Klein and others, a human study, considered the gold standard, at least at one time, was the double-blind study. In a double-blind study, they took patients that suffered low back pain for the average of 10 years. In order to get into the study, you had to have back pain unrelieved by any other method: surgery, cortisone, manipulation, acupuncture, drugs, etc. They took 81 patients and divided them into two groups of 40 and 41. One group got the non-irritating injections times 6. The other group got the irritating injections times 6. Neither the patient nor the doctors knew who was getting the active treatment or not. When they broke the code, they found that 88% of the patients with just 6 treatments improved dramatically, as opposed to those not getting. And they published that in the Lancet, and then they published a second study, tweaking a little bit, 7 years later. That was published in '87. In '93, 6 years later, they published a study in the Journal of Spinal Disorders, again finding similar results. So it's been done and repeated in a study. So here we have the spine. Just to point out a few things, here we have the interconnecting ligaments in white. Here we have the bones in beige, and here we have the shock-absorbing and spacing disc in the red. And here we have the spine that has been early injured. The ligaments are torn or stretched from the bone. Now here is from Dr. Hackett's book, but I took it and redid it and put it in my book. Is a very important slide, because people feel that if you have pain in your back and it goes down to your leg, that it's a herniated disc, and that the disc is pushing on the nerve and you need a disc surgery to fix that. And that's true, that condition does exist, but actually it's more of a rare event, in that most of the referred pain is called sclerotomal pain. It's in the medical literature, but doctors don't know about it. You need to be a reforming or a rehabbing doctor like Dr. Trowbridge and I to know that it's sclerotomal pain. And what that says is that ligaments and tendons and connective tissue refer pain acting like nerve pain. And in my experience, it's much more frequent than true discogenic pain. Pain caused from the disc impinging on the nerve. And so common areas where the problems are is in the sacroiliac ligament, the iliolumbars, the gluteals, as well as the lumbars, which we haven't put dots on, get too dot crazy. And this can refer pain into the buttock, into the hip, acting like hip pain, but is actually coming from the sclerotomal or ligament and tendon referred pain in the black dots and go down the leg, the thigh. It usually skips the back of the knee into the calf and into the foot, skipping the ankle joint. On this same area, the ligaments and tendons frequently refer into the groin, into the testicles if you have them, or are fortunate enough to have them still, into the anterior thigh and the lower leg and foot, acting like nerve pain. And this same process occurs with the knee, with the shoulder, with the neck, and they're going around saying, well, you got nerve pain, you got nerve pain. They do all the scans. Hopefully you don't get operated, because most times it is not the problem. It's this sclerotomal pain. Here we have a spine illustration from my book showing that the discs have become degenerated or herniated from inadequate nutrition, wear and tear, injuries, falls, whatever. And that causes a loss of height. That causes a laxity of the ligaments, which in turn, your body must form the spurs of arthritis as its last-ditch attempt at stabilizing the joints. And this would be an artist illustration showing the regrowth of the ligaments, okay, after reconstructive therapy. And so that takes the wobble or the friction out of off the disc, so they can get their hydration, they can get their nutrition, they can heal, and even since the friction is there, even in time, you can start to resolve, slowly you can start to reabsorb the spurs. And this is what it looks like if you get it early enough, the repair of the tears of the ligaments, the primary issue, and so that you never have to go into the wearing down of the disc in the spurring phase if you get somebody early enough. This guy here, that's me. And you can tell I'm a hell of a big man, no question. And you can tell that he's a little bit bigger. Now, he had all the signs of a herniated disc, and he went to a famous clinic. I won't mention its name. It's about 6 hours from my clinic. It's in Minnesota. And they could not get him. That was before the days of the open scanners, and even with Crisco, they couldn't get him through the hole of the CAT scanner. And the surgeon told him at this famous clinic that you have to, with your weight, you only have a 2% chance of success with a disc surgery. Well, we used a special technique to shrink his disc, not the chymopap pain that's coming up, and then we reconstructed his back. Well, they both basically told him that to just lose weight and he wouldn't have this problem. Well, that didn't occur, but anyway, we reconstructed his back. He came in with 2 crutches, could barely get on the table, wasn't smiling like that, and that's been over 10 years ago. That he didn't lose any weight, but that's just, yes, it's absolutely a health advantage to lose weight, but as Bill and others have said, myself, it's easier said than done, and it's not. There's plenty of people that are heavy that do not have joint problems. Let's just put it that way. Let's do our own separate, open type of research that's part of the medical game of always putting something out of reach. Here we have a patient from the 80s. Here's the normal disc space here, a spinal x-ray. Here you can see it's like a knife blade in there. He had the chymopap pain. That was the almond pit enzyme, originated in Canada, at University of Wisconsin, other places. And they started it in the early 80s. And what it was is to dissolve the herniated disc. Well, he had that surgery and he still had the pain. But maybe those of you recall that procedure started in the early 80s and resolved because of death in the later 80s. Because remember, I said when they stop a therapy, it's not from side effects, it's from death. Well, he didn't die, but he just wasn't better. And so we reconstructed him. Here's a side view. We reconstructed him back here. And there he is in 8 treatments, was 80% better in his own words. This is another patient from the 80s who had back surgery, acupuncture, manipulation, drugs, cortisone, exercise. All that failed to resolve him. We reconstructed him. He went back to work at the AMC Corporation. That's when there was one in Kenosha, Wisconsin, lifting heavy auto parts for in their construction. Here's another Kenosha patient, also worked for the AMC Corporation, had 32 years of back pain following her herniated disc surgery when she was 19 years of age. She lived like many people, just gritting her teeth, popping pills, ad lib type of thing. On her first visit, her husband come in and said, I knew I was in trouble, because the husband come in with her, and said, Dr. Faber, he says, I know Linda's not a complainer, but when we take our mobile home south to Tennessee for our summer home, her tears go down her cheeks from bouncing in the mobile home before we get to the state line. Well, Kenosha is almost on the Illinois state line. And so this is what her spine looked like. Very huge spurs as her body was trying its dangest to stabilize her joints over that 32 years. And so we reconstructed her back here, the primary stabilizing ligaments. And not only did she make it to their summer home in Tennessee without tears, but before the treatment, she would be just shot for a number of days after she got there from the bouncing. Well, she changed her hairdo, but not only did they get there, they built a new summer home, and she moved 3/4 of the cement blocks herself for the summer home. So here's the neck, my favorite area to treat. Here's the neck ligaments. Notice the diameter of the neck ligaments are actually larger in diameter than the largest vertebra, C2. And this is what they're like from being torn. This could be, some people can get a real bad deal, and this can occur with delivery, in that the purpose of delivery is to control the head. The head's the biggest thing to deliver. And when the baby goes into the birth canal, it goes into flexion, and that's where the delivering person is to stabilize that head, because there's tremendous force on a uterine contraction, and if that head is not controlled, it can just whiplash. So these people can be given a bad deal right from birth and have that torn. Of course, more commonly, the whiplash hit the Cadillac, or probably been killed in a Ford, huh? Or falls, or those sports people, or just holding your head up can weaken these ligaments and give all kinds of problems. This is where they start going into the degeneration of the disc and the spurring from these torn and stretched ligaments. These areas, commonly torn at the base of the skull and in the neck, can refer pain into the different areas of the skull, mimicking different types of headaches, into the maxillary area, mimicking different types of sinus problems or different types of headaches, into the jaw, mimicking dental problems, also going into the shoulder and arm. But rather than true nerve pain, they are the sclerotomal pain, as I referred to earlier, as pain from ligaments and tendons that are relaxed but not noted. Here's an x-ray, a relatively normal x-ray. And this is a patient that we've done that had all the neck vertebrae broken, C2 through C7. She was paralyzed for about 6 months. She was in an pedestrian auto accident at 8 years of age. She had all these vertebrae fused at 8 years of age. All fusions are destined to failure. Hers is the longest fusion that I've ever seen work, 30 years. At 38 years of age, it started to fail. It gave her headaches and neck pain and arm pain. She went to two Milwaukee major medical meccas. They told her that they needed to remove the disc that was herniated, according to them, at the bottom of this fusion, because it's true that your unfused area gets more stress. It's like if you take the hinges out of a hinge out of a door, there's more stress on the remaining hinges. So they said at the bottom of her fusion that she had a herniated disc. They needed to remove that. Then they needed to pound rods into her mid-back. And both institutions said that. By the way, there's no guarantees, and there's no, you could be paralyzed and have other problems. From that, she knew about fusions. This is just a bigger fusion when you put the rods in. And for some reason, she came to me, and I said, well, what I think we should do is to loosen that surgical scar, which would be back here, you can't see it, and from your first surgery and 30 years ago, and then go down and normalize these nerves with the neural therapy, the Blue Book instant pain relief, which Dr. Trowbridge talked about. And that gave her instant relief, okay, of her arm pain and neck pain. She had some residual, and about the following 8 times, it was completely gone. At this time, I told her, I says, I hope I did not do you a disservice, that I now recommend we do the reconstructive therapy. So here's an example of a layered problem, a complexity. Like Bill's problem is a complexity. He had, obviously, he was kind of a hospital case with passing out and getting handcuffed in the neighbor's yards as a vagrant and as a louse or whatever. And so that had to be solved with your nutritional metabolic, and then he could enter into your joint problem. This would be 2 nerve problem and a tissue tension structural problem, and then a structural problem. So this is what it looks like reconstructed, and this is so magnificent when somebody gets a good strong neck. It does so many things. That's why my favorite area to treat. It helps sleep. If they can't sleep, they can sleep. If they sleep too much, it normalizes their sleep. Usually they don't sleep too much, they can't sleep. It helps balance. Go to a doctor for balance problems. Holy man, what a circus. Go to a doctor and say, I have a heavy head. Well, everybody does. They really don't understand it, but it's because you're supporting, they don't understand gravity, that you need your ligaments to hold you up, and that's a primary sign of it. So another problem that people have is that they're helped by chiropractic or osteopathic manipulation, but it doesn't last. So they're in a cycle of getting chiropractic adjustments, and then they go out, and then they get another one. Well, I'm not saying anything against gentle chiropractic osteopathic manipulation. It is a good and effective therapy. However, you should get better fixed. So if you find yourself getting an adjustment and then you fart and cough and go out again, well then most likely your primary stabilizers, your ligaments, are not holding you. And so reconstructive therapy is indicated. So everybody here in Humble is listening to the same radio station, and that's the one in your head, WIIFM, which is What's in It for Me. And that is illustrated in this slide. I think in just one slide it illustrates what's in it for you, in that the tissue and strength increase potential possible with reconstructive therapy is defined as, let's assume that you did not have a traumatic delivery and you did not have a genetic problem, and so in your childhood you are 100% strength and structure. And then with traumatic bursts, wear and tear, gravity, injuries, cortisone, drug therapy, surgeries, all which are very detrimental to your structure. You may be only 20% of your normal strength and structure. But with reconstructive therapy, we can go to 100 and proven 140%. So we can actually do stronger than normal. So what does that mean? Well, that means super joints. So we're going to talk a little bit about superjoints now. This, it's hard to see, but that's his 1988 Barcelona gold medal ring and gold medal that he won in the Barcelona Olympics for lifting 470 pounds deadlift in his weight category. He developed wrist pain and weakness. We reconstructed him and continues to compete as a world-class athlete. This gentleman had back and hip problems. He won the Minnesota Championship running 26 miles. We repaired his back and his hip. He continues to compete as a nationally ranked athlete. This was sent to me unsolicited in about 1990. This is in 18 years earlier. He was just 19 years of age. They wanted to do a rotator cuff surgery on him. He couldn't shift his shifter of his manual shift car. He also had severe neck problems. And he sent me this unsolicited. He's got an unusual ski rope, but he's barefooting. Okay? Now, those of you that are not skiers, it's easiest with 2 skis. There's more stress through your body with 1 ski, and there's massive more stress through your body with no skis, which he is there. So he says, Doc, thanks for the overhaul, and signs his name. As we repaired his neck, I skipped one. There he is. Now he's barefooting, holding the ski rope with his teeth. Neck feels great. Thanks, Scott Schultz. No, this is not an advertisement for, what, Picopay? Is that what they call it? So, in summary, reconstructive therapy even works for bone-on-bone arthritis, as you've seen examples of that. The therapy can be effective for disc disease, as you've seen examples of that. The therapy can be successful regardless of how many years the problem has existed. The therapy is effective for osteoarthritis, regardless of its severity, the most common kind of arthritis, as you've seen examples of that. The therapy is effective for failed bone, joint, disc, tendon, ligament, or cartilage surgery, or as alternatives to those surgeries. The main effect of the therapy is increased structure. Once you get the structure back, you get function, you get strength, and you can last. You get endurance. The main side effect of the therapy is less pain. Once therapy is given adequately enough times with adequate healing abilities, the therapy is permanent because new tissue is created. So let's review the traditional medicine schema of medicine and surgery schema of joint treatment with a little elaboration one last time. Assume someone starts with normal joints. They have an injury or wear and tear, genetic problem, etc. Their first step is the anti-inflammatory medicines. In 1990, in the Journal of Rheumatology, they published a study with people with hip arthritis. In that study, they divided them into 2 groups with the hip arthritis. One, they gave ibuprofen or indomethacin, the famous arthritis medicines of Indocin or ibuprofen. The other group, they gave none. They gave them a numeric score as to the degree of their hip arthritis, both groups. So they waited 2 years. One group took none, the other group took the anti-inflammatories. They found that in the group that took anti-inflammatories, when they re-x-rayed them 2 years later, they found that the group with the anti-inflammatories progressed in their arthritic disease by x-ray. Why? Because inflammation is the body's healing stimulus, so when you take cortisone, when you take anti-inflammatories, it's the easy, quick fix, but with long-term bad, detrimental problems. So the next step, they say, well, you need exercise and physical therapy. There are benefits to physical therapy, and there are benefits to exercise. However, you cannot, it has never, ever been shown that you can exercise a ligament, a tendon, a cartilage, a disc, and make it stronger. You can exercise your muscles, you can exercise your brain, you can exercise your heart, and make them stronger. That is known. But a tendon, a ligament, a joint, a connective tissue, a cartilage has no fibers that will increase in response to exercise. They are fibrous tissue. They're not muscular tissue. And they've never been shown to hypertrophy or regrow in response to exercise. It's like exercising your car door. Open, close, open, close, open, close, open, close. Does that make your car door stronger? No, it does not. Same with exercise. In fact, many of you know, because you've been through, I'm talking a lot to the choir, that you've been through that, and you know that you can't take those exercise programs, that they invariably make you worse. So, now we're going to go over one of the blessed sacraments in Orthodox medicine is the cortisone. Cortisone was developed in the 1950s by a famous medical clinic. I won't mention its name, but it's in Minnesota. Cortisone has the effect of increasing infections, aggravating or causing diabetes, aggravating or causing heart failure, decreasing immunity, causing candidiasis and other infections. And the one we're concerned about is that it stops wound healing, literally stops wound healing, in that collagen matrix is not allowed to form. The backbone of the laydown of the fibroblast is not allowed to form in the presence of cortisone. So when that doesn't work, then they give the mini surgery, the arthroscopy surgery we spoke about. And there's maybe you've heard of it. Baylor Medical College did an amazing study a number of years ago, and they took medical students. It's an amazing study, but if you don't believe it, go down there. They did the study. Go find it. And they took 180 medical students, and one group they gave the arthroscopy surgery. Both of the groups were indicated to need they felt needed the arthroscopic surgery. The one group had the actual surgery. The other group just had the holes put in. And it was blinded. They were not told who had the real surgery and who didn't, the medical student patients. When they broke the code, those that had the sham surgery did better in every parameter. And that study has been repeated in Canada and other places in the U.S. Well, I'm from Iowa, Missouri. How do you make something stronger by taking stuff out? Somebody explain that to me, because I haven't figured that out. So when that surgery doesn't work, they give more cortisone. Maybe a new anti-inflammatory has been invented, and they say, oh, this is much better. But that all goes to the same place. When you hit the 6-0, it used to be. Now they're going even younger, and even at the 5-0, and sometimes even younger, they say, oh, you need a joint replacement. Okay? And that lasts maybe a few years. The worst one that we saw, we saw a lady that had 4 fake hips, same hip, in a 9-year period. And she wasn't seeing us because her hip was good. Yes, you can use reconstructive therapy effectively on those people. So this is not my picture, but is a picture from a medical journal discussing modern knee joint surgical therapy. One person saw it and called it the bubblegum baling wire and sealing wax method of knee joint treatment. So, reviewing the biological or the apple method of joint treatment, we start with normal joints. We have an injury, wear and tear. Our first steps are to normalize the nutrition, detox the body from substances, quit putting them in and take out what's there, heavy metals, etc. Careful manipulation. If that doesn't work, careful exercise, careful physical therapy, bracing, and rest. If that doesn't work, we apply reconstructive non-surgical therapy. That can give us up to 40% more strength and structure than normals, and so we can go to super joints. So in near final summary, reconstructive therapy is the only proven therapy on the planet to regrow tendons, ligaments, and cartilage, bone, connective tissue, and nerves. The therapy is preventative from further injuries or arthritis, as well as providing optimal performance. So it comes down to the three little pigs. I don't know if you Texans get that story, but in Iowa we get it. There's a little pig with the straw house that doesn't last very long, gets the quick fix, and the little pig with the stick house lasts a little bit longer. But we know that the little pig with the brick house that took longer time, reconstructive therapy does take longer time in that people say, well, I'll just get it over with. I'll get the surgery. I'll get it over with. So the quick fix, you just get the one surgery. With reconstructive therapy, it's a regrowth. We need multiple treatments to bring it out, to complete it. So it's a problem for a lot of people in that this guy, Warren Buffett, says your best investment is to invest in yourself. And that's what reconstructive therapy is, an investment in yourself. But it's the gift that keeps on giving, that it is so wonderful. At every Christmas, I get cards and letters from people I haven't seen in years and years that are telling me how well they're doing without treatments from me or anybody. But every case where we've been successful, they've done the little red hen. Did it themselves. Okay? Yourself with a knowledgeable, talented doctor and God's healing does it. So in final analysis, one must take up the pen and write one's life story. And you must write it to be a romance adventure. Otherwise, if you unattended, it'll just be a tragedy. And why would we want that? So this is the book I wrote. I wrote it simply because there was no way out for the public. The medical profession wasn't telling people that there was a proven method that could get them out of the slavery or the indentured servitude of the hospitals, the pharmaceutical companies, and the doctors. It's been tremendously successful. It's in its 13th printing. Most books don't even sell their first. Only by word of mouth, only by small groups like this. And our website. And I'm honored to be here. And thank you, Dr. Trowbridge, for having me. God bless you all.
Okay, I'm Suzanne Rogers. I'm from the Woodlands, Texas, and I've been coming to Dr. Trowbridge for about 4 years. Just a brief summary here of what I've written in honor of Dr. Trowbridge. I suffered a chronic infective septicemia causing severe fatigue, pain, and lack of sleep. I required an IV of antibiotics as well as high-dose clindamycin, which I still take the oral dose, but I'm avoiding a lot of my IVs because of the customized treatment that I'm receiving. I did natural immune boosting treatments as well as customized medical treatments as directed by Dr. Trowbridge when the previous treatments failed to provide improvements. Dr. Trowbridge saved my life from one of daily pain, suffering, and disability. Thank you. Do you want me to go on to the rest of it? I would like to cover some of the other things that have been really important to me, because in 1983, I was injured while flying on a major airline. I had 2 back-to-back injuries, and the interesting part of this is when you have an injury, anyone that's had an injury, you know that everyone in the world wants to take out a part of your body. So 50-plus doctors all wanted to operate on 3 discs. My hands, they wanted to take out 2 ribs. For some reason, I resisted all of them over the course of a 5-year period. And during this time, I realized I was really sick, and I knew I had a massive infection, but nobody would listen to me. All they said was I didn't want to go to work. So in walks my first shrink, and he gave up on me within 5 minutes. He said, "You're fine. You don't need me." Anyway, so my good friend of mine knew a doctor in New Orleans that studied bacteria. I went to him, and within 45 minutes, I had an answer. He used a test that pathologists do not use in this country anymore. Anyway, that doctor treated me every 3 months until he retired in 2001, and then he passed away in a couple of years. His wife found a doctor in Georgia, so for the next year, I went to Georgia. that doctor, fortunately for me, said, you know what, you would really benefit from chelation therapy, and I happen to know a great doctor in Houston. So all these years now, think about it, I traveled every 3 months to go and be treated, and I could have been here. The crazy thing is I knew about this doctor because he did FA, he worked for the FA and did a lot of the, what am I trying to say? Pallant medicals. Anyway, I was so mad at myself. I thought he's been at my back door, 40 minutes away. But when you have to understand, when you're doing all the stuff I had to do for all those years, the last thing you need is another doctor. So I kind of ruled him out. And he, just was kind of, I guess, in my hip pocket. Anyway, the doctor in Georgia encouraged me to give a call, and I did. And I want to make a comment about my husband because he's 10 years older, and so when I made the decision that I would go to Dr. Trowbridge, I told him I made the appointment, but we were both going, and he said, no, I don't need to go. And I said, well, you're 10 years older. I'm not going to prolong my life without prolonging yours. So the other interesting part of his story is I think he decided on his own, I don't know, Dr. Trowbridge may have told him, but he decided to go have a heart scan. He was told that he would have a major heart attack in 5 to 7 years. So we both made a big commitment to chelate every week for that year. And at the end of the year, he went back and had a second heart scan. And our other doctor that satisfies the PCP for your insurance companies looked at us and said, there's no way. I mean, that's not what happened. He said, well, then they just diagnosed it all wrong and read it all wrong the first time because that wouldn't do that. So anyway, back to my story, though, I now am able, whatever he has told me to do, I do, and I am able to go 9 months. And when I do get a little sick, it's nothing like what I used to, because when I got sick prior to Dr. Trowbridge, I literally thought I would die, and I would think I will never make it to go out of state for the next treatment. But anyway, this man, I believe, is probably going to get me where maybe I don't even have to go and have these treatments if I'll just continue to listen to him. So anyway, he's a great person, and I know all of you would agree with me.
What would be the process to determine if my husband's pain is really nerve pain or the sclerotomal referred pain I spoke about? The process is always the same. Come in and get an evaluation, basically. For myself, it's almost a never that I get. We want plain films. Bring your plain x-ray films when you see Dr. Trowbridge, and bring any previous medical records, but bring the actual x-ray films, not the reports. And we can tell quite quickly at usually one visit if it's, most of the pain is the sclerotomal pain and not true nerve-originated pain, thank God. So thank you, very good question. From Alfonso Hernandez, can you help me after 3 back surgeries and shoulder pain and bone spur pain? Dr. Trowbridge had 3 spinal surgeries. In Iowa, we would say, is a pig's butt called ham? Would be the answer. Sometimes people can understand what I'm saying. What is the process? What is the process to begin RT or PRP? Well, you come in and get an evaluation, bring your x-rays, complete your history. Peggy Hernandez, what will this process do for fibromyalgia? Wonderful question. Read chapter 18 of Pain, Pain, Go Away, written by myself and Dr. Trowbridge. We labored on that chapter to put it there so that you can understand. But in that case, don't schedule the appointment. Read the book first. If it seems like we're talking about you and the way it's designed is it'll be about you. Read that chapter first. So don't come in first. Read chapter 18 of Pain, Pain, Go Away. From Dorothy, my mother's name, Legler. Jordan, do the glucosamine chondroitin pills do any good? Does one want waste their money on them? Well, I think that it's a significant advance from the ibuprofen, in that there are studies that show that it's about as effective as ibuprofen. It just takes longer. And further, they're not toxic. There is a problem with the chondroitin portion of it, in that it's a big molecule and it causes constipation or GI in some people. But no, I don't feel it's a waste. The people that we see, you need about 2 months at higher dose to take it. What is it, about 1,200 of glucosamine, about 1,000 or so? 3,000 of the glucosamine per day? And how much of the chondroitin? You don't use the chondroitin. Use gelatin, Knox gelatin instead, or capsules. 3,000 a day for 2 months should be inadequate if that's going to help you. If you're not happy, read the book, come in and get a consult.
How much money have you made on the book?
I've never made a penny on the book. Basically, I wrote it simply because the public needed to have it. The only way you make money in books, Dr. Walker, who's our co-author, has written over 50 books, is you need to write trash. You know, and that's how you make money on books, like Danielle Steele or, you know, those type of things. You need to write that trashy stuff. But if you write in a concept book, it's more of a mission in life, and that's why I wrote it, is to help other people. Donna Blassingame, I have pain in my hip and legs after several hours of going to bed. If it's okay after I get up, it's okay after I get up and walk. Several hours of sleeping, I have hip and leg pain again, and the cycle starts again. So let me get this straight. I have pain in my hip and my legs after several hours in bed. And then she has to get up and walk around. Several hours of sleeping, I have hip and leg pain. Sounds like magnesium is one of the first things that come into my mind. Dr. Trowbridge, in a single visit, can tell you it's a special dosing of magnesium and special forms of magnesium, and that's why he stocks his own supplements, as I do, is because if you go to the Walgreens, you should go there mostly for motor oil and candy and Valentine's Day's cards, but their vitamins are just crap, basically. They're not really high quality. If you go to a quality health store, you can get better, but it's the quality and then what you're taking. And why we stock them is, I would prefer not to and show with Dr. Trowbridge, because it fills up our offices and it costs us money to have them, but we're basing our reputation on we want results, and if we don't know what they're taking, you know, you just say, take magnesium. That's like writing a prescription, say, take medicine 3 times a day. Well, any medicine, any quality, any dose? I mean, so it sounds like that. It sounds like something we could do, but we need to look at that. Bring your x-rays. Have you seen your other doctors, Donna? No? You might first start with your other doctors. Oh, you've seen this? Okay. 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 Well, all right. I always love the questions of patients and the patient giving things. Okay. James Blassingame, how does RT treatment work on carpal tunnel? Works wonderfully. How? Very well. In the carpal tunnel, what they say is, from the orthodox, says that you have the swelling from repeated use of the wrist, air guns, hammering, grasping, etc. And then they say that we want to cut your ligament because the swelling has compromised the nerve of the median nerve. Well, God did not give you an extra part, actually. Even the appendix is not an extra part. And you know that structural parts are to, particularly ligaments, they want to cut the transverse carpal ligament. And there's a chapter in it in my book on showing how. But when you cut the ligament, there are studies that show that the ligament, the wrist diameter increases 10% by cutting the ligament, because the ligaments hold the bones together. And it really wrecks those people. So actually, we rebuild their ligaments and tendons of their wrist because they get it, unless you have it from pregnancy. You're not pregnant, are you? No? Are you sure? Okay. They get it from repeated motion, etc. Sometimes fluid disease, but that's not the bulk of it. That's for doctors to know. They get it from using their wrist primarily. And so they stretch out their wrist ligaments and tendons. We need to rebuild them. Same as with the other joints. Thank you. Good question. Jim Caldwell, when would you do blood platelets prolotherapy over reconstructive therapy? Good question. I don't know yet. We started doing the PRP in November of last year. And we're not, at this point, remember, Dr. Trowbridge and I are old-timers in medicine. And I think it's good therapy. I'm doing it. I have it. But being from Missouri, I have to be shown. And we have had the therapy, both Dr. Trowbridge and myself have had PRP. And I'm not to the place where I can honestly answer it. I'm kind of a doctor that says, if you go down to Baylor or Texas Heart or something, they know everything. But I say I don't know. Would be my answer to that. I'm not. Ask me. Maybe you'll have me back next year, and maybe I can answer that question. I think it's a good therapy, but I don't know. So enough on that. Do the bone spurs go away? It takes time, but there's less cracking, there's less popping. And then you need to wait a number of years later when the patient has completed their RT and X-ray them. But all the evidence is yes. But I don't have a slide showing that yet. Maybe in 5 years I'll show the slides of the spurs going away. Nancy Sutton, in relation to sclerotomal pain, God, you Texans can listen. Can't do that up where I'm at. Does it cause burning pain and numbness in the feet? I have lots of burning in the right thigh often. Is there such a thing as nerve pain due to back pain? Yes. Yes, the herniated disc is nerve pain, the herniated disc, but as I said, it's a lesser cause. This would need an evaluation, of course. It all starts there to X-ray the back, possibly the legs, to give you the better answer. Is the burning pain... See, the burning bothers me. This kind of makes more of a metabolic potential thing, where you have actually one of the top, if not the top person in the world for metabolic therapy right here. If you have stents put in, can you still benefit from chelation? Is the Pope a Catholic? Would that be an answer? Okay. All right. You like the pig's butt better? Okay. What causes tailbone pain after sitting for a few minutes? And Dulcie, is this a man? Yeah. You guys got different names. I'm sorry. That's why I asked that, because usually it's a female tailbone problem. In that the female anatomy is different. Who knew? But For one, there's a slight difference that the females tend to have babies. Men don't have them in the same way. And the baby's head can actually hurt that coccyx. And so, and it can be a very miserable problem. And so, but we have found success with the neural therapy, the reconstructive therapy, and possible gentle manipulation for that. What do you think about non-surgical spine decompression? Joanna Cook. Well, I do not have one of those units, but I have seen people that have them. And you sign up, I think, typically for a 20 treatment. Has this, Joanna, have you had it? And are you baiting me? So you already know the answer. So you're just testing me. You've had the 20 sessions? Well, you didn't have to pay 20 in advance? You didn't buy your 20 in advance? Well, Texas style is 3 dozen. Up here, they want you to have 20. The patients that I've seen have reported some better, but then they come back and pay me money. Another aspect is I know that it's only about 80 pounds of pressure that they put on. And so that's not, I would be concerned about excessive, but I'm kind of concerned about the stretching on the ligaments type of thing. Well, the inversion is a good thing as long as you go to the 2 8 o'clock position. You can buy the units for $200 yourself, and you go to the 2 8 and just have the weight of gravity working for you. Because there's studies that show if you go all the way, it increases your interocular pressure and your cranial pressure and can cause even scleral hemorrhages. Were you setting me up on that? Okay, he's setting me up on that. Okay. Ozone therapy, you mean the prolozone? For the proliferative therapy with reconstructive therapy with ozone? Well, Dr. Schellenberger and myself have known Dr. Schellenberger for many years. Dr. Trowbridge and I have known Dr. Schellenberger as a main promoter of that therapy. And Dr. Rowan is also a main promoter of that therapy. And we think that they're smart, intelligent guys. But I got kind of a WTF with what they're doing on that. Ask somebody to translate. I hate to use acronyms, but here I am. We think these are great guys, but it's... Anyway, next question. Oh, over. If inflammation is good, should you put ice on Bach? Mm-hmm. Yeah, I did it the British way. Well, I'm a little different on the ice. I like a warm blankie myself better. But the ice is better if you have an acute swelling after an acute injury, after a swelling or heat. Okay? But the problem with ice and heat is that if a little is good, a lot is, yeah, the American way. And it's not really that. It's Goldilocks. Do you know her? How did she like it? Come on, tell her. Just right. We like it just right. So in the heat or the ice, we want it 10, 15 minutes. Don't freeze the skin. You can cause damage, and same with the heat. So, but it's kind of, you're kind of asking me home remedies. There's value to those, but it doesn't really get you out of things if you got a serious problem. So the last one would be, is electrical stimulation helpful? I probably bought over the years most every type of electrical stimulation. And do you want to buy one? I think they're good, but it doesn't really get you out of anything of significance. But Gavin Azada, my wife, do you say Pilar? How do you pronounce that? Pilar? Suffers arm pain, both the right arms and the left arms, while in bed early in the morning. She had head and neck injury in 2004 car accident and had cosmetic type heart surgery. You do cosmetic heart surgery down here? God, that Texas. And that's called cosmetic heart surgery.
I just call it.
Okay. Anyway, so they did the heart surgery by entering through her ribs rather than splitting her sternum. In '97, where the right arm was strapped over her head, that stressed the arm. Well, there's the answer pretty much, and so now she's got arm pain. Actually, in the new book that we're writing, Dr. Trowbridge is contributing, there can be a problem with the surgery and the positioning, as you kind of alluded to, that first of all, when you go under general anesthesia, that is not going to sleep. It is going near death, actually. It's literally near death. All doctors know it, but you're not going to sleep. Yes, you're losing consciousness, but there's planes of anesthesia, and the next plane after the surgical plane is called the death plane, okay? So you're just right hovering. They knock out your breathing. They have to breathe for you, and they knock out your consciousness, okay? So that's why people say, man, I got that anesthesia bill, and was that ever high? Well, because there's a little complication called death. It's very, very serious to go underneath it. Further, as Ron pointed out, with the orthopedic surgery, they don't mention it, but it is the highest risk for pulmonary embolism and stroke, orthopedic and neurosurgery. Now, those things can cash your check permanently, and therefore nor mortgage nor tax bills. It's all done. Okay? But also in the book we're pointing out is that the positioning of the patient is an incredible important thing, in that they paralyzed your muscles, so you no longer can resist and hold back. And a stretch on the ligaments, the tendons, and particularly the nerves can be very damaging. So we could have a nerve injury. We might need to do the neural therapy. We might need to do the neural therapy, which is another topic, but to normalize the scar of the cosmetic heart surgery. We might need to look at the shoulder. We need to look at the neck. We need to look at the upper back. This is where the experience and skill of the physician is big time. Look at the plain films, the plain x-rays. And I think that's it.
Ignore all that FBI stuff, because you're free to share copies of your DVDs when we get them for you to anyone who has a need to know. And of course, that means that folks who are suffering will thank you forever for sharing that.